Meet Dr. Carson. He's the jungle's most respected doctor, smart, compassionate, and always smells faintly of disinfectant and bananas. When a monkey breaks an arm or catches jungle fever, Dr. Carson shows up with a smile, a stethoscope, and a medical bill big enough to buy a small banana island. In this jungle, getting sick isn't just bad for your health, it's financial suicide. One banana allergy test, 500 bananas. A quick tail surgery, 20,000 bananas, plus a mysterious 5,000 administrative jungle fees. Need banana insurance? Good luck, that's a whole other jungle full of headaches. But why? Why does something as simple as staying alive cost more than a golden coconut? To figure that out, we need to peek inside how the banana healthcare system actually works or doesn't. Let's start simple. In most jungles around the world, monkeys chip in a few bananas each month to a shared pot. When someone gets sick, that pot pays for their care. Pretty straightforward. But not here. In the jungle, things are complicated. Instead of paying the doctor, monkeys pay insurance companies, who sometimes pay the doctor, but only if the stars align and the moon is full. Each banana travels through a long chain of middle monkeys. Insurance agents, coders, auditors, administrators, each taking a tiny bite of your banana. By the time it finally reaches Dr. Carson, half of it's already gone. And the prices? Totally made up. One monkey gets charged 10,000 bananas for a broken tail, another pays 800 for the same fix. It's like a banana market where nobody, not even the banana farmers, knows what bananas actually cost. Meanwhile, pharmaceutical companies swing through the trees, demanding hundreds of bananas for pills that cost pennies to make. Why? Because they can. They patent the formula, slap on a fancy name like Bananalix XR, and sell it back to sick monkeys who just want to stop coughing. So next time you hear a monkey say their hospital bill costs more than their treehouse, remember, it's not because medicine is rare. It's because the system is built so that everyone gets fed, except the sick monkey. Now that we've seen how bananas vanish before reaching Dr. Carson, it's time to talk about the jungle's most confusing creation, banana insurance. Banana insurance is supposed to protect monkeys from losing all their bananas when they get sick. Every month, monkeys hand over a few bananas to the insurance company, believing it will cover their medical bills later. It sounds smart, right? A little safety net for when life throws a coconut at your head. But in practice, it's like paying a guard monkey to watch over your banana stash and then realizing he's been eating half of them while you weren't looking. Here's what usually happens. A monkey hurts his tail, visits the hospital, fills out a dozen banana-colored forms, and waits patiently for weeks. Then, instead of getting help, he receives a letter that says, "Claim denied." Why denied? Maybe the injury wasn't in the approved tail category. Maybe the hospital wrote the wrong banana billing code. Or maybe the insurance company simply decided to save a few extra bananas that month. Inside every hospital, there's a small army of administrative monkeys who spend their days translating treatments into mysterious number codes. Every banana peel, bandage, and tail scan gets its own special code. If one number's off, a small 100 banana bill can suddenly explode into a 10,000 banana nightmare. Even Dr. Carson can't keep up anymore. He just focuses on treating monkeys and hopes the paperwork gods smile on his patients. Meanwhile, hospitals keep expanding. New buildings rise with glass elevators, golden banana fountains, and giant signs that say, "Now open for wellness." But none of this actually makes monkeys healthier. It just makes the bills fatter. All that fancy infrastructure, extra lighting, and endless administrative staff have to be paid somehow, and that somehow usually comes from the patient's pockets. What's worse is that the cost keeps growing while the care doesn't. Even though monkeys pay more bananas than ever before, they aren't healing faster or living longer. They're just getting better at signing forms, filing claims, and trying not to scream at customer service. So while Dr. Carson works hard to heal the jungle, the system around him keeps turning health into paperwork and bananas into profit. By now, it's clear that Dr. Carson isn't the villain. He just wants to help sick monkeys. But somewhere between his clinic and the banana bank, something goes wrong, and it all comes down to banana profits. You see, deep in the jungle's shiny towers live the big banana companies. They sell pills, bandages, and miracle syrup that make monkeys feel better. But these companies don't just want to heal monkeys, they want to feed their profits. So when a new banana pill comes out, it doesn't cost a few bananas, it costs thousands. Why? Because only they know the secret banana formula. They call it research and innovation. And yes, research is expensive, but not that expensive. Somewhere in those costs is also a shiny office, a banana-shaped fountain, and a dozen executives sipping golden banana smoothies while talking about shareholder value. Then come the middle monkeys, the distributors, the pharmacy managers, the marketing teams, and the lawyers, all taking a small bite of the same banana. By the time the medicine reaches a sick monkey, there's barely any fruit left. It's just peel and paperwork. Meanwhile, insurance companies and hospitals quietly agree to special banana deals behind the scenes. Prices aren't fixed, they're negotiated. One monkey gets a tail surgery for 2,000 bananas, while another pays 10,000 for the same thing because his insurance plan doesn't have the right banana network. It's like going to a fruit stand where the price of a single banana depends on what kind of smile you give. The cashier. Dr. Carson sees all this and feels helpless. He prescribes affordable banana pills, but the jungle pharmacy says, sorry, that's not covered. So he switches to another one, and suddenly, the price triples. The truth is, the jungle's healthcare system runs less on care and more on banana flow, the movement of bananas from one layer of bureaucracy to another. And as long as that flow keeps feeding everyone except the patient, prices will never fall. At the end of the day, monkeys aren't paying for health, they're paying for access to it. So if you ever wonder why healthcare costs so much, remember, every time a monkey buys medicine, a dozen unseen paws reach out to take a piece of the banana. But don't be too sad because knowledge is the first step toward change. And maybe, just maybe, if enough monkeys start asking questions, the jungle might find a way to make healing a little less expensive. And of course, this isn't financial or medical advice. It's just a funny story about bananas.